Assalamualaikum everyone. My name is Aisha Yusuf and I am from Department BS Chemistry and my presentation topic is Tranquilizer Chemistry. In this presentation I will discuss about Tranquilizer Chemistry, what are its uses, side effects and what are its classification, and also some important drugs such as chlorpromazine and benzodiazepines, and what natural materials we can use instead of tranquilizers and how does it works in our body. So this is what I have to talk in this presentation. The best tranquilizer is a clear conscience. It is said by American scholar Franklin. Do you find yourself feeling stressed out when you are studying before any important exam or when you are practicing before any presentation? So the answer is yes. Obviously, it's perfectly normal to feel stressed out or anxious every now and then. Unfortunately, for some of us, our anxiety can get so out of our head that chronic feeling of anxiousness and fear is the making of anxiety disorders. So, for the purpose of treating this type of chronic anxiety disorders, we basically use tranquilizers. So, the question arises here: what actually are tranquilizers? Tranquilizers are the chemical substance used for the treatment of stress and anxiety, irritability, and which as a result leading to calmness are called tranquilizers. Whenever we get hypertension, we are using such medicine that could make us calm, and that's why they reduce our stress also. So therefore, those chemicals which we are using to reduce stress, they are basically our tranquilizers. Now take a look at the history of tranquilizers. Tranquilizer as a term was first used by F. Youngman in 1953 from the conclusion of investigative studies using the drug reserpine. Around 1900, German scientists working for the drug company Bayer synthesized the first synthetic barbiturate sedative. Later, another scientist, Leo Sternberg, the inventor of revolutionary class of tranquilizers that included Valium. Now talk about the types of tranquilizers. Tranquilizers basically come in two varieties. The first one is major tranquilizer and the other is minor tranquilizers. So what is the basic difference between the major and minor tranquilizers? First is major tranquilizers. They treat major state of mental disturbance. As they treat major mental disorders, so they are named as major tranquilizers. They are also called antipsychotics or neuroleptics. For example, one major mental disorder is schizophrenia. In this situation, persons show abnormal social behavior as well as patient fails to recognize the reality, and also patient could not even realize what is the reality. And the second one is minor tranquilizers. We can also say minor tranquilizers, anti-anxiety and anxiolytics. It treats milder states of mental disturbance. As they treat milder state of mental disturbance and less serious mental disorders, so they are called minor tranquilizers. Let's take a look at its uses. There is reduce anxiety disorders. There is insomnia. So insomnia is a lack of sleep during the night, and also it is used in the combination of other drugs. It may also act as muscle relaxant. Now talk about classification of tranquilizers. The first is major tranquilizers. Major tranquilizer is further classified into phenothiazine, butyrylphenones, and the third is miscellaneous agent. The derivative of phenothiazines are chlorpromazine, prochlorperazines, and the third is trifluoperazine. And the derivatives of butyrylphenones are haloperidol, and the second is trifluoperidol, and the miscellaneous agent has class thiothiazine, and the second one is minor tranquilizers. It is further classified into benzodiazepines, propanediol carbamate, and the third is raw wolfia alkaloids. The derivative of benzodiazepines are chlorodiazepioxide, diazepam, and lorazepam. And the classes of propanediol carbamate is meprobamate, and the third is raw wolfia alkaloids has derivative reserpine. Now talk about some important drugs. Now I'm going to tell you about some important drugs. Since there are many important drugs, now I will discuss some important and popular drugs. First of them is chlorpromazine. Okay, alright. Basically, it is a class of antipsychotic tranquilizers, and chemically they have phenothiazine ring. So, what is the phenothiazine ring? Phenothiazine means three benzene ring fused have nitrogen and sulfur group, means thia and azine group. As you see in the given structure, three benzene ring are fused and the nitrogen and sulfur is fused in the middle ring. So this is phenothiazine ring, and the chlorine is attached to one benzene ring, so it is also called chloropromazine. Now take a look at the uses of chloropromazine. It has a wide range of uses, as it belongs to major tranquilizer class. So it helps in treating major mental illness such as psychosis, schizophrenia, and other mental disorders. And its second use is the treatment of attention deficiency and hyperactivity, which is mostly seen in small children. It is also very helpful for relief and anxiety before surgery, as well as it increases the potential of some drugs such as analgesics. So it is used for surgical and diagnostic purposes. It is also used for the treatment of tetanus and nausea and vomiting. In this situation of tetanus, it basically controls the level of acute porphyria. What is porphyria? Porphyria is basically nothing but it basically controls the level of porphyrin, which affects the central nervous system, CNS. In its properties, we can say it is very stable to heat and sensitive to light. So for that reason, they are to be protected to be light during storage, and they are storage in airtight container because oxidation in them is very rapid. The second most important drug is benzodiazepines. It is the class of minor tranquilizers, and we also say them diazepam. Benzodiazepines, sometimes called benzos, have chemical structure which is the fusion of benzene ring and the diazepine ring. It is basically the fusion of two rings. One is benzene ring and the other is diazepine ring. As shown in the figure, that the right ring is benzene ring and the other is diazepine ring. In this figure, the right is diazepine ring and the left is benzene ring. Its uses includes the treatment of an anxiety, and also it is used in the treatment of insomnia, that is lack of sleep during night, use for muscle relaxation. It is also used in stress, agitation, and panic attacks, and it is used in the combination of some other drugs, so it is called anticonvulsant. In its properties, we can say they are colorless, white, and very slightly soluble in water. So, what are the side effects of tranquilizers? Since tranquilizers have positive effects, but the other thing is, and it is a main thing, that it may have many side effects. So, let me talk about its side effects. It can lead to us drowsiness, dizziness, and confusion. After consume after consume tranquilizers, it may have headache, because it is very addictive, so there is increased risk of fall and injury, and it become really worst if combined with alcohol. There are basically two types of side effects. The one is SSRIs, which is a derivative of selective serotonin reuptake inhibitors, and the second one is benzodiazepines. SSRIs increase the available level of serotonin. What is serotonin? Serotonin is basically a neurotransmitter or brain chemicals that is associated with the regulation of our mood and anxiety. But SSRIs tend to produce some stomach upset when they firstly take. They are also cause gut cramps and diarrhea. You may feel tired also and need to take naps, and you also have to get extra sleep. Another side effect is the people feel in vivid dreaming. Studies reveal that 0.4% people, it means 4 out of 1000 who take tranquilizers, will experience increase in suicidal thinking. And also your body quickly dependent on SSRIs. And the other is benzodiazepines. Benzodiazepine must be used with caution because they are very addictive and can cause dizziness, memory problems, sleepiness, and also difficulty in concentration. It is physical addiction which are happen within only days, hours. In some cases it may be weeks. Now take a look at how does they work in our body. Tranquilizers work by modifying certain nerve communication in our central nervous system to your brain. Tranquilizer is basically a chemical substance which we discussed already, that reduce our stress and why stress occur in our body. So basically our stress is the because of low concentration of non-adrenaline in our body. Non-adrenaline is the one of neurotransmitter that play a role in mood changes. It is the most important in our body. If non-adrenaline means the amount of non-adrenaline reduces in our body, our stress increases. There are certain enzymes in our body that catalyzes the degradation this non-adrenaline, and so by consuming tranquilizers, they affect those enzymes which are degrading the that is non-adrenaline. Therefore, by affecting these enzymes, this chemical or this tranquilizer, they maintain the non-adrenaline degrading in our body, and that's the reason that we are away from the stress. For why? This is how basically the tranquilizers works in our body. The other concept is, it is seen that girls showed a high prevalence of tranquilizer use, and it were 2 times more likely to use than boys. It is shown in this graph that we can see in this age difference between 10 to 12 years children, the ratio of girls who take tranquilizers is double than boys. That is seen, the girls percentage is 2.6 and the boys is 1.6. That is a double, and the next onward is same as previous. So the next question is there anything who can be replaceable to tranquilizers? So the answer is yes. There are many natural ingredients which help to reduce anxiety, stress, etc. Nature products which help to reduce anxiety are follows. Anxiety is never a fun or joke. Most people take it fun or joke, but the people who really have anxiety or stress may have many disastrous effects. So take a look at nature products which help to reduce anxiety. The first one is ashwanda. It is basically found in North Africa and India. Ashwanda, it is one of the most effective herb which reduces our hormone level 28%. So the hormone level which it reduces is serotonin, which I already discussed. It is the a neurotransmitter which is play important role in our anxiety or mood changes. The second one is chamomile. It is one of the most powerful adaptogens which affect our body system and hormones and allow you to regulate stress hormones. The research shows that compound in chamomile can bind to same brain receptors as drugs, and that is basically great for treating anxiety disorders or long-term treatment for generalized anxiety insomnia disorders. And the third is passion flower. It is a lovely flower. It is which is very effective for treating anxiety and insomnia. And the third is kava kava. We can say it kava in short. So this is basically very best when anyone have acute anxiety attack. And the five is lemon balm. Lemon balm is very effective herb. It relaxes the body very effectively. In 2011, studies revealed by taking 300 milligrams of lemon balm lowered the anxiety level 15 to 18%, and it also lowered insomnia about 42%. And the sixth one is brahmi. One brahmi is the most effective herb again that increases your level of serotonin and increases peace of mind and also help the body to cope with major stress. And the seven and the last one is motherwort. We can also say tulsi basil. It is one of the best herb for balancing our blood pressure and also helpful for people for getting sleep. So if you have any questions, you can ask freely. Thank you so much.